3 years ago, most of us had never heard the term COVID-19, and then it hit. Now, as we begin a new year, the public health outlook in our region looks very different, though once again, the news from China is cause for concern. This morning, an update from Vermont's physician. Joining us this morning, Dr. Mark Levine, Vermont's Commissioner of Health. Welcome back to NBC5 In Depth.
Great to join you again.
Well, happy to have you and happy holidays. We are at the start of winter season with sort of a new combination of facts and factors to discuss, and I want to ask you about all of it this morning. But first, influenza and flu vaccine this year. Flu seems to be, am I reading this right from your weekly reports, sort of your top concern at the moment?
Certainly, it's increasing in frequency to the level that it should be a high concern, but there are so many respiratory viruses around all at the same time. We don't test every person for every virus, but we would probably find a number of them are co-infected with viruses even. But for the last week or two, per the CDC's surveillance report, we are at high levels of flu in the state of Vermont. We were, prior to that, one of only about a half a dozen states that were lower than that. So we're kind of late to the game. Much of the country has already seen its peak and is starting to come down a little bit. We're probably still getting into that peak area. Having said that, though, the reality is people have been gathering, of course, for holidays and coming together again. So I suspect there will be more transmission of respiratory viruses from person to person for a little while longer.
The flu vaccine, which is kind of a crapshoot every year because it's developed well in advance, this year is thought to be on target and particularly effective.
Absolutely. We have experience from the Southern Hemisphere to understand the constellation of flu virus types that were being seen. And we have some now on the ground experience much earlier in the season than we ever have before. Because as you know, most of the flu, though it evolves over the course of the winter, it often peaks in February, March, and can still present even April and May. This year, the whole nation is seeing a very rapid escalation of flu prior to the new year even. So that's much different. I will caution us to realize that there are two types of flu, influenza A and influenza B. And the ones we are seeing right now are in the influenza A family. Often later in the season, we may end up seeing influenza B. So it doesn't mean when we get out of this part of the flu season, we're totally out of the woods.
12,000 Americans die of influenza each year. So is the message that, it's not too late, it's still worth your while to get the vaccine?
Absolutely. The fact of the matter is, just like with the COVID vaccine, the promise is not that you will avoid infection. The promise is that you will avoid a serious outcome from an infection. And that's very true of the flu vaccine for years and years and years now. And I would not want anybody to say, probably it's too late. It's still good timing.
Let me ask you about RSV, a respiratory virus that got a ton of attention right around Thanksgiving and in the days following for causing a spike in young kids getting admitted to hospitals with serious respiratory infection. What is the situation here in local hospitals in cases that are being reported to you?
Yeah, so we seem to have reached and now passed our peak of RSV. The Northeast was really a hotbed of RSV activity. The major population we're worried about are the very youngest children who have never seen the virus before and have very narrow airways and can have more complications with their breathing from the virus. This year, because of the use of masks and other mitigation strategies in the last couple of years, a whole population of younger kids that aren't just infants, but that were in their first few years of life also had serious infections with RSV. And there were concerns about overwhelming the healthcare system around the nation and here in the Northeast. We actually in Vermont never reached the point where we couldn't care for a Vermont child who needed hospital level care for RSV. And though we were stressed out and maxed, we had really good luck with being able to maintain capacity for anybody who was ill. I'm happy to say that though RSV hasn't disappeared, it's a much diminishing part of the viral spectrum that we're seeing right now.
There are good therapies. To what degree is RSV, potentially lethal?
Yeah, so the major therapies are much more in the way of support in terms of a specific magical medication. Though there are medications to help with breathing, obviously, but really the technology that's been most effective has been what's called high flow nasal cannula oxygen, which is actually delivering high levels of oxygen to an infant without putting them on a real ventilator and putting a tube in them to have ventilation. This has been a real advance. We use it in the hospital. We're now able to use it in our transport through EMS from outlying hospitals to critical care units in major hospitals. And it's really been a major part of the success of treatment this season.
Let me ask you about that other elephant in the room, COVID-19. Are there new variants that you are concerned about? The news this week has been, the rather surprising policy shift in China that is seeing huge spikes in cases, and now they're opening their borders for the first time. So where are we in terms of sort of new emerging variants?
So prior to the China experience, my answer to this question was always, this is really smooth sailing for COVID as COVID goes. We've been seeing the Omicron family and subvariants of Omicron for quite a while, since actually the beginning of the year, so almost for a full year now. We're currently seeing less of the BA5, which was the dominant kind of strain, and a little more of the BQ family. These are subvariants of Omicron still, though. They have a little more ability to evade our immune system and the vaccine, but we're not seeing more serious illness or outcomes at this time. Until this time, we've not really been seeing anything new in terms of a true new variant, something like when Omicron first arrived or when Delta was first on our shores. Now with what's going on in China, where we've had a population that's been highly protected against ever getting a first infection, and now are more free and moving around and interacting and stressing their healthcare system because of the level of illness, there's always the concern that because of high levels of transmission of virus, and especially when it's transmitted to some who may not have great immune systems, the ability for a new variant strain to develop is always going to be there. So we have to be a little bit cautious now as we look at our future with COVID, knowing there's this very large population in Asia that is pretty much naive to the virus and is now going to have unprecedented levels of infection and ability to transmit. Just the kind of substrate we saw earlier in our pandemic when new variant strains developed. So we'll have to keep a very careful eye on that, but really there's been no new variant strain on the horizon for quite a while.
We're talking this morning with Dr. Mark Levine, the Commissioner of the Vermont Department of Health, and we'll be talking about cases of long COVID and his views on the retirement of Dr. Anthony Fauci when we return. We'll be back after this. Back this morning with Dr. Mark Levine. The latest statistic that I saw suggested that people are getting weary of this COVID-19 vaccine, this new bivalent the update. Only something like 13% of eligible American adults have gotten it. For the record, I am in that camp, but what does that tell you? It seems as if, and I hear people say that, I just don't believe it's necessary anymore. What do you say to that?
Yeah, so you're right. The nationwide number is probably in the 14% range now. Vermont, even though we never used to be proud of numbers like this, is leading the nation at 30%. And in our over 65, which is the most vulnerable population, we're probably in the 63, 64% range. So I guess I can say we're doing pretty well. But the reality is people are fatigued with the pandemic in general, with vaccines in general. I think the experience with Omicron, people now knowing people all the time who have the virus and seem to end up doing okay, has made people think that, well, gee, I'm in an environment where there's a lot of vaccinated people, even if they haven't got the bivalent, they got the previous vaccines. They are boosted with the monovalent. They have access to testing. They have access to treatment if they get really ill. And they're perceiving that the potential value of the bivalent vaccine is a little bit reduced. However, I would say that, you need to always remember that the reason for these vaccines is to protect us from the most serious outcomes. And you don't want your immunity to wane and allow you to be susceptible. And we know that with the new bivalent, not only is it a little broader in coverage, having covered the BA5, which is still around, though decreasing in frequency, but it's also true that people's immunity wanes the longer they are from their last dose of the previous vaccine. So most people who haven't chosen to get the bivalent are many, many months out from having had a dose of any COVID vaccine, and they would still benefit knowing that they're protected against the serious outcomes. I do think also another explanation is people are focused on other things now. Not only are they tired of the pandemic, but they're also focused on trying to return to the priorities in life they had prior to the pandemic and to their own recovery and revitalization. And that's very understandable human nature.
Let me ask you.
Again, just like with the flu vaccine, never too late to get this bivalent booster.
You think we're going to be needing one of these each year?
It looks like about an annual will be important. We're still evolving in our knowledge about that, obviously, as time goes on.
What percentage of people who become sick with COVID, seriously sick, or maybe who become sick and recover, then develop long COVID symptoms? And what is the number one complaint or symptom that you hear?
Sure. So it's hard to give you a precise percentage because there's abundant studies that are just coming out, all with different numbers, and people define long COVID differently. The CDC had some data come out that looked at symptoms that were persisting longer than 4 weeks after getting initially infected. Mm-hmm. But we know with lots of viruses, people don't feel like they fully recovered for quite a long number of weeks. I usually use a 3-month time zone to really understand someone who's going to have long COVID as opposed to just prolonged significant illness. The numbers there are anywhere between 10 and a high ball of 30%.
Wow.
Now, when you think about it, even 10% of a virus that now most Americans have had some experience with, that's a lot of people. The symptoms are very varied. I would think that the number one symptom would be really unremitting fatigue. And that's fatigue, whether without exercise or with exercise, but just feeling much more tired than one would feel that allows them to be productive. And if they do exert themselves, having very little tolerance for that. But there's a whole plethora of symptoms, some of which involve the lungs, and some of which involve the heart, some of which involve the brain. Things like the brain fog people describe, ability to concentrate, their memory, etc.
I want to ask you about the retirement of Dr. Anthony Fauci, who, with you, now almost 3 years ago, sort of burst onto the scene when the coronavirus emerged from China and scared us all. He became a lightning rod for criticism, particularly from the right.
The degree of divisiveness in this country right now has really led to such a polarization that it has interfered with an adequate science-based public health response. I mean, differences in ideology are healthy. It's part of our democracy, part of what makes our country great. But when they get so extreme that it prevents you from doing something that's life-saving, that is really awful.
And I'm wondering what you would say about Dr. Fauci and his contribution to public health in America.
I would say his impact on public health and health in general on America has been profound. And he's been a leading proponent and shown a great ability of being able to integrate public health and clinical medicine together and show that a data-driven, science-based approach in decision-making will really bear fruit and is very, very productive. He's also, lesser known by the public for this, but his longstanding personal and cultural commitment and collaboration and research has been very critical. And part of why he's stayed in the job he has with the federal government is to actually continue to allow that research establishment to flourish and to really inform how we look at especially infectious disease and immune system problems going forward in our country. And he's been an incredible collaborator across the nation with the scientific establishment and internationally as well, which is very, very important.
One of the challenges that you both shared is that with an emerging threat, you don't have all the perfect answers you'd like to have on day one.
Yes, and I've been very appreciative and hopefully used as a nice model, his clarity of communication, his ability to be very empathetic, but his ability to confront misinformation head on and call it for what it is, while still managing somehow to be a gracious man that he's always appeared to me to be. And I very much have appreciated his collaboration with us in Vermont, the fact that he actually virtually came to Vermont at one of our press conferences, carried the message forward to the nation, how he would love Vermont to be a model for everyone, and really praised us for the work that we had done in Vermont with the pandemic.
Do you, Commissioner Levine, have any plans to move along in the new year?
You know, I hate to say it, but I'm still enjoying what I'm doing. I think that, the pandemic obviously put a highlight on one aspect of public health, but I'm very eager to shine the spotlight again on so much of what public health means, so many of the problems that I know we have the capacity, ability, and energy to still try to work on and solve and improve people's life situations. So given the opportunity, I'm more than willing to continue that task.
Dr. Mark Levine, the Commissioner of Health, a pleasure having you back here on NBC5 In Depth.
Great being with you, Stuart. Thank you.
Coming up,